How's your week been?
It's been quite interesting, actually. I brought the diary. It's been really useful, so I'm really, really glad you gave me this. I mean, even by the end of the week, I was maybe even drinking a little bit less because I'd just gotten a bit aware.
So you found some sort of benefit increasing that awareness?
Yeah, absolutely. It is something that I probably need to look at.
That's it, and it all takes time, Sharon. There's no reason to be too hard on yourself.
Yeah.
Just being here today is a huge positive step. So at this organisation, we work in a 6-session framework. We roll over every 6 sessions with a new plan. Sometimes they're called recovery plans, sometimes they're called treatment plans. It's just to make sure that we're staying on track and we're setting goals. One of the things you mentioned was cutting down on your alcohol. Would you be comfortable with me placing that as one of your goals here?
I think so. I think that has to happen.
Seeing the diaries work quite well for you so far, do you feel like that would be something that would assist you in cutting down, just continuing to keep that alcohol diary? Is that all right if we pop that down in an action?
Yeah, absolutely. I think that would be really useful, actually.
Is there anybody who comes to mind who may be able to assist you in achieving this goal?
I think Brian probably could, but I think...
Brian is your partner?
Yeah.
Okay.
He will need some support on that because we clashed a bit during the week.
We can definitely look into that as well, so it's important to have that trust. All right, anything else that you could think of that may assist in any way in cutting down with the alcohol?
I should really stop drinking before work, but I'm a bit scared about that because I'm scared that I'm going to be too anxious to go to work. So, yeah, but I think that's something that needs to happen.
So, cut down or stop drinking before work?
I think stop drinking before work. I get a bit anxious about my job. I don't think I've ever tied that to drinking.
So you're seeing a bit of a connection there between the anxiety and the drinking and work. So potentially what we could do is have a little bit of a holistic look at your life. It doesn't just have to be about your drinking. It can be about anything. Is there any sort of things that you do that you really enjoy and it just sort of takes your mind off everything?
I've always loved walking. I can walk for myself with music. I can't believe I haven't been doing that. Well, I guess actually the drinking probably ties in there as well because, we'll have a few after work and then it's a late night and I don't have time to walk.
Okay. And life can be really busy sometimes and it can be hard to find that time out for yourself. Yeah. But just going for those long walks, listening to some music, what would you like to call it? De-stressing? How would you name that?
Well, I think ultimately it is anxiety management, but it's used to kind of centre me. I think there's no better way of putting it.
Maybe we can make it anxiety management / centering myself.
Let's do that.
Just maybe in a park or something like that, or through the neighbourhood, or is it?
Look, if I can get to the beach, that's great.
Beach, okay.
But even along the river works, as well. I like near water ideally.
All right, so I'm just putting down here, beach walking.
Yeah, or river.
Listening to music. And how often, like ideally, if it was up to you, how many times a week?
I think it's just every day that I can.
Every day that you can?
Yeah.
Okay. And that sounds good. It sounds like your work is, it can be a bit unpredictable the time you get shifts. And I'll just again remind you not to be too hard on yourself, Sharon. This is goals that you're setting now, and you can do your best to achieve them. If you get out once, fantastic. If you get out 7 times, fantastic.
Yeah.
You know what I mean? It's all a step in the right direction. Yeah. Now, just going through your alcohol diary, having a bit of a look at it, and you're saying, it was the drinking has increased from when first started work. Do you feel that it may be at a level where getting a health checkup at the GP wouldn't be the worst idea in the world?
I mean, I still feel okay, but just because I feel okay doesn't mean that I am okay. I think I need to get checked out.
Yeah, okay. It sounds like a safe idea and a good plan ahead. Would you be comfortable popping that down as one of your goals at the moment?
Yeah, I think so. I do. I think it's the kind of thing that you can really put off, but I think if it's there, it's going to be harder for me to put off because I've committed to it now, haven't I?
Well, that sounds like a really good plan moving forward. Yeah. So we've got one goal left. One goal left in the plan. Yeah,
this I think is probably outside of the drinking, probably the really big one. And I mentioned it before when I said, Brian is my support. We fought a lot this week.
Okay.
I think he's about to become a grandfather and he wants to change everything, and I certainly don't want to do a complete and utter U-turn in my life just because he feels like making some changes. And he doesn't really understand that, and so we've been fighting, and I think we're not good right now. In fairness to him, maybe I haven't been as there for him, but I don't really think he's there for me right now either. So I think we do need to, find a way back if that's possible.
I think that's definitely a healthy step forward.
Would you see Brian with me? Is that how this works?
That's definitely a possibility. We could set the counselling up to be like that, and potentially I could send a referral out to an organisation that does relationship counselling, and you and Brian, as long as Brian is agreeable and so are you could go out and see that together.
And to be honest with you, for all of that other stuff to work, this is the thing that really needs to work, because I need his support for all of that other stuff.
It does sound like it's really important to you, this relationship. Working on what's going on there, as you're saying, could help with all of this other stuff as well. It's a really holistic way of looking at your life. It just doesn't have to be about your alcohol use, even though that's one of your goals.
Yeah.
That's not all of your life. It's all these other things that make a difference. They do connect with each other and do have an impact on each other as well. If you just want to have a look through the plan, give it a bit of a summarise.
So I'm cutting down alcohol. I'm going to continue. I'm going to fill those diaries.
That's working.
I'm going to stop drinking before work. And Brian's going to help me, and I'm going to help myself there.
Fantastic.
So, yeah. Going to do some anxiety management, and I'm going to do some beach or river walking with music. And I'm going to do that every day that I can, getting a full health checkup with a doctor. And yeah, the relationship stuff between Brian and me. So I have to talk to him, during the week, and hopefully he will be fine with that, and I'll let you know.
Yeah, please
so
do.
that you can do a referral for us. Yeah, I'm good with that, and it's not huge. It's a start. I can manage this
You
stuff.
feel that this is achievable?
Yeah.
That's the most important thing. What we'll do, we'll review this in 6 sessions, and at that stage we'll be able to evaluate if we need to set some more goals,
Okay.
or maybe if you're happy with what you've achieved and you're comfortable to move on from there. If you feel like you've got some new goals, we can book you in for a further 6 sessions. If you're comfortable with that plan, if you could just pop a signature down the bottom, and I'll put it through the photocopy and we'll both have a copy.
Yeah.
Fantastic.
Okay, I'm
Thank
happy
you.
with that. Thank you.